I'm sure we've been hearing about erectile dysfunction, and most of us don't know what it is. Well, erectile dysfunction means difficulty keeping or getting an erection firm enough for sex. It means difficulty getting an erection or difficulty keeping an erection firm enough for sex. This doesn't mean the man is weak. It doesn't mean the man has less desire. It doesn't mean the partner is less attractive. And I'll explain this further. An erection starts in the brain. When a man is aroused, either by thought, by touch, by attraction, the brain sends a message to the penis. This message travels through nerves, and when it reaches the penis, blood vessels relaxes and opens up. Now blood flows into the penis, making it firm. That's an erection. I'll repeat this again. An erection, like I said, starts in the brain. When a man is aroused, either by his thoughts, either by touch, or either by attraction, the brain sends a message to the penis, and this message travels through nerves. When it reaches the penis, blood vessels relaxes and opens up. Blood flows into the penis, making it firm, and that is an erection. But when the brain stops sending this message, the erection goes down. So in simple words, the brain sends the message, the nerves carries the message, and blood flows to the penis. So we have the brain, we have the nerves, and we have the penis. The brain sends the message to these nerves, and the nerves picks up the message and tells the penis, oh, it's time for an erection or something. Occasional failure, it's normal. But when it keeps happening repeatedly, the body is sending a signal saying something is wrong, just like a car. When it breaks down once, that's acceptable. But when it breaks down repeatedly, that means the car needs to be checked. Now, what are the real life signs? 1. The man cannot get hard. 2. The man loses an erection quickly. 3. The erection, even if he has an erection, it's not strong enough. Note, when someone has any of this sign, don't feel shy, don't feel withdrawn, don't think, oh, I have failed sexually. Erectile dysfunction is often a health signal, not a sexual failure. Why does erectile dysfunction happen? What causes this erectile dysfunction? Why does it happen? 1. Blood flow problems. The penis needs strong blood flow. High blood pressure, heart disease, diabetes all reduces the blood flow. This condition narrows the blood vessels over time. And when the blood vessels is tight or damaged, less blood reaches the penis. Just like oxygen struggling to pass through a narrow pipe. Now think of the penis like a balloon and the blood vessels like pipe. If the pipes are blocked or damaged, the balloons can't fill properly, right? That's why an erection becomes difficult. I have said blood flow problems. 2. Nerve problem. You know already, I said earlier, that the brain sends a message through the nerves to the penis. When the nerve is damaged, either from diabetes mellitus or from injury or from anything that can block this message, if the message can't travel, the penis never knows it's time to get erect. Just imagine a messenger, which is the nerves. You can't get information from the master and take it to whoever the master is sending it to. That means you're useless. That's how the nerve is. If the nerves cannot pick up message from the brain and send it to the penis, the nerve is useless. 3, I would say hormonal problems like testosterone or any hormonal problem. This could also cause erectile dysfunction. 4, mental or emotional problems. With this, I mean stress, anxiety, depression. All these can block the brain signal. Another thing that can also cause an erection is fear of performance. When the man says, oh, am I going to perform well? Am I going to have an erection? That fear alone can block the brain signal. And the key line is the brain must feel relaxed for the body to respond. 5, I would say lifestyle and habits. And someone will say, oh, how does my lifestyle affect my erection? How does my lifestyle cause erectile dysfunction? Daily habits affect blood flow and hormonal balance. Daily habits like smoking. Too much of smoking is not good. It could cause erectile dysfunction. Poor diet, obesity, lack of exercise, all these reduces blood flows and weaken erection. Simple way to say it, I'll say bad habits damages blood vessels and erection depends on healthy blood vessels. Someone will say, how can smoking cause erectile dysfunction? You don't know that the cigarette or the cigarettes we take in contains carcinogens. Those are like cancer-like cells. This will destroy the ability, the blood vessels, and reduce the ability for a man to be able to have an erection. Another thing that could cause erection is medication and illness. Some medication can interfere with erection as a side effect. Example, blood pressure medication, antidepressant medication. Most of us don't know most times that when we take medication, we may be using it to treat something else, but there are side effects to that medication. I might be taking blood pressure medication to reduce my blood pressure, but then I can't sleep well at night. I keep on having this constant headache. But if I read through, I would see that, oh, it's this particular medication that is giving me this headache, that's making me restless. So that's how it is with erectile dysfunction. Some medications can also cause erectile dysfunction. So when an individual has erectile dysfunction, don't say, oh, what is it? Is it all just my problem? It could also be as a result of medication. For those of us that are just joining, I would recap from the beginning. I was talking about erectile dysfunction, and I said erectile dysfunction means difficulty getting or keeping an erection firm enough for sex. Difficulty getting an erection, difficulty keeping that erection firm enough for sex. It doesn't mean the man is weak. It doesn't mean the man has less desire. It doesn't mean the partner is less attractive. Now, let me explain this slowly. An erection starts in the brain. When a man is aroused, either by thought, either by attraction, either by anything, the brain sends a message to the penis. This message travels through the nerves, and when it reaches the penis, blood vessels relaxes and opens up. Now blood flows into that penis, making it firm. That's an erection. Mr. A is the brain, Mr. B is the nerves, Mr. C is the penis. Mr. C says, oh, I like this woman. I'm aroused by her touch. I'm thinking of this lady. I need an erection. The brain has signaled that, oh, Mr. C needs an erection. Mr. B, come, go tell Mr. C that he has to have an erection now. That is how it works. So when the brain stops sending the message, the erection goes down. So in simple words, brain sends message, nerves carries this message, blood flows into the penis. Simple. Occasional failure is normal, but when it keeps happening repeatedly, the body is sending a signal. Just like a car. When a car breaks down once, that's acceptable. But when it breaks down repeatedly, that means something needs to be checked. What are the real life signs of erectile dysfunction? The man cannot get hard, 1. The man loses an erection quickly, 2. Even if the man has an erection, the erection is not strong enough. And note, when you have any of this sign, don't feel shy, don't feel withdrawn, thinking you've failed sexually. Erectile dysfunction is often a health signal, not a sexual failure. And I said, why does erectile dysfunction happen? 1. Blood flow problem. Let me explain this. The penis needs strong blood flow. Things like high blood pressure, heart disease, diabetes, all this reduces the blood flow. This condition damages or narrows the blood vessels over time. And when the blood vessels are tight or damaged, less blood reaches the penis, just like water struggling to pass through a narrow pipe. Now think of the penis as a balloon and the blood vessels as a pipe. If the pipes are blocked or damaged, the balloons can't fill properly, right? That's why an erection becomes difficult. Two, I said nerve problems. You know, I said earlier, the brain sends message through the nerves. Now, when that nerves is damaged, either from diabetes, either from injury, anything could damage that brain. This can block the message, and if the message cannot travel, the penis will never know it needs to have an erection. Three, I said mental and emotional problem. With this, I mean stress, anxiety, depression, all these can block the brain signal. Do you know that fear of performance can also worsen erectile dysfunction? And the key line is that the brain must feel relaxed for the body to respond. The man might say, oh, will I be able to have an erection? Even if I have an erection, will it be able to stay long? All this can all this contributes to erectile dysfunction because that man is already mentally and emotionally stressed. Four, lifestyle and habit. Daily lifestyle affect blood flow and hormonal balance, which are both needed for strong erection. Things like smoking too much, alcohol, poor diet, obesity, lack of exercise, all these can reduce and weaken an erection. Simple way to say this is bad habits damages blood vessels and erection depends on healthy blood vessels. Five, I'll say medication and illnesses. Some medications interfere with erection as a side effect. And I remember I said, example, I am taking blood pressure medication, thinking that, oh, I am using this blood pressure medication to reduce my high blood pressure, not knowing that there are other side effects to this blood pressure medication. And one of the side effects could be erectile dysfunction. So when an individual has erectile dysfunction, don't think you're the problem. Think of the surrounding problems. It might not be that individual, it could be as a result of that medication. Now, when do you seek help? You seek help if the erectile dysfunction has lasted for months, lasts long, maybe months, occurs with diabetes or high blood pressure, and comes with pain or numbness. Those are the time you should say, oh, I really need to be checked. I really need to see a doctor. I really need to see a health practitioner. And I'll close this by saying erectile dysfunction is not a shame. Ignoring it is the real danger. Strong men take care of their bodies. So with this, I hope I have educated you about erectile dysfunction. And I would say like this life and share to your loved ones so they could come regularly to also benefit from these health tips. Bye.